if you have any advice, there's 40 folks on this call. Any advice for anybody entertaining the thought of studying abroad and then specifically ending at UQ? I don't know if it's what you would have done differently or I wish I would have known, but any advice from a year four student?
Yeah, not so much what I would have done differently or what I wish would have known. I think I probably would have done the exact same thing. Maybe studied a little bit harder, but you always say that. I think advice-wise, I think medical school-wise, like just to quickly touch on the dropout rates, like most of the people over the 4 years I know who dropped out weren't for academic reasons. They did realize they didn't like medicine, they didn't want to pursue it, personal reasons, wanted to be with family, stuff like that. So, you know, the program is set up in a way for you to succeed, and they've done a really good job with the new program to actually give supports to pass from an academic standpoint. So, which is really all they can do. So I think most important thing to keep in mind is medicine is a very long journey, a lot longer than people get it credit for. And it's probably lost a lot of the glamour it had in the past. And this is not Australia specific, this is true in Canada as well. Like when I was at Ottawa, there's a whole presentation where they served 2,000 Canadian medical students, and they're like, well, why is no one going into surgery? And they found that especially because they thought like especially for female students, and they found that like no, female students had female role models. There are tons of female surgeons now. It had nothing to do with exposure. People just don't want to do surgery anymore because it's no longer as appealing as it is with the long hours. And so I think it's really something to keep in mind, the lifestyle of a doctor and sort of the lack of consistency you'll have in your life for a good couple of years. And you'll have different hours. You'll be moving to different hospitals, different countries. Like I did 12 weeks in Australia, 6 weeks in Canada, now 6 weeks back in Australia, then 6 weeks in the US, then 6 weeks back in Australia, and then I graduate. And mine's probably the more extreme example, where there's a lot of sort of more personal turmoil. You got to get used to traveling around the world, being adaptable, and sort of it'll be a long time before you actually finish. Not to say it's not rewarding. I love getting to see patients. I love getting to see how I can help them and how much they often overcredit me for very minor things I do. But I think one thing I would say, keep in mind of how long of a process it is, and it's a slow thing. Don't rush into it. Think about it, take your time. And when you get in, enjoy the experience. It's 1 year at a time. Don't go into the mindset where I just have to get through this and then something will happen. And I think that's good just for life in general. Medicine in particular, there's always another year, there's always another exam, there's always another challenging patient. It never really ends. So you gotta, as the saying goes, like embrace the grind, embrace the suck, and try and get like sort of what you want out of it, what makes you happy, what keeps you motivated, whatever that may be. So that little bit of general life advice. Medical wise, I think, moving to Australia, it's sort of the biggest adjustment, probably sort of with the time difference, but I'm staying at my like high school friend's house here in Toronto while I'm doing my elective. It is more than possible to sort of, stay in touch with your friends, stay in touch with your family, and sort of maintain both sides. It's just a balance you have to achieve, and you have to make the effort to stay in touch with people. Otherwise, I've really enjoyed all my time in Australia for it to come. It's a really great place to work, and that's the reason a lot of Canadians didn't stay behind because Australian internships tend to pay more and you work less hours. So they tend to be a lot stabler on the work-life balance side. And then, you know, UQ specifically, I really enjoyed the student part of it because it's such a large cohort. It was found it easier to make friends that like I truly got along with. Like when Canada played in the Four Nations hockey tournament, a bunch of us had our GP exams that morning. A same group of Canadian students I'm here. My exam ended at like 11, and we all rushed to the nearest bar, convinced them that ice hockey exists and yes, the NHL is a sport. And then like 20 of us watched the Canadian game together. And so, and obviously cheered when we beat the US in overtime. So there's a lot of really good experiences to be had in medical school. It is a really cool thing and a privilege to get to do medicine. But I think keep in mind that it's a long journey and there's a lot to keep in mind on your side. Academically, if you're at the point that you're probably attending this call and you're interested, you're probably highly motivated enough and good enough academically to get it and succeed. It really depends if it's something you want to do, where you want to do it, and what's going on in your life. So I think keep that in mind, but give it a shot. It's, I think, a lot less scary than people think it is. And you'd really learn a lot more about sort of the world and medicine and yourself when you take the opportunity to go somewhere different. So I highly, highly recommend UQ. I don't think I would have done anything different.
That's great. Thank you. Professor Kumar, I was going to ask you the same question. I feel like you've got something to follow here. It's going to be a hard follow, but I was going to ask you if you Like looking at the cohort, you see how students act and behave and perform. What advice would you have for them kind of all around in school, out of school to make their experience in Brisbane a great one?
Yeah, look, I didn't train at the University of Queensland. I trained in Singapore, and then I did my specialist training in the UK, PhD in the UK before coming to Australia. So I've had a fairly international sort of career pathway. But I think the unique thing about medicine, as Pranav has touched on, is that it's quite an experience unlike any other. It covers so many facets of human life, science, and technology, and so on. And so it's really important to keep yourself grounded. And I think that goes back to your initial motivation for wanting to study medicine. I guess people have different motivations, but if you're going into medicine because you want to become a surgeon and earn lots of money, perhaps that's not the best motivation to do. You've got to genuinely like people. You've got to genuinely care about people. You've got to genuinely like to talk to people, and so on. And I think you've got to have a bit of a social conscience as well. There are lots of opportunities to study. There are lots of opportunities to do very, very interesting things, and there's lots of opportunity to have fun in medical school. And I think UQ is a fantastic place to study medicine.